Hello and thank you for joining us today. This video is part of an educational cancer video series created by the University of Chicago Comprehensive Cancer Center's Office of Community Engagement and Cancer Health Equity. The Office of Community Engagement and Cancer Health Equity serves as a bridge between University of Chicago cancer researchers and the communities we serve, providing cancer information, resources, and education. Today's video is in honor of Pancreatic Cancer Awareness Month, which is recognized every November. We're joined today by three expert panelists from the University of Chicago Medicine. Our first panelist is Dr. Uzma Siddiqui. Dr. Siddiqui is a professor of medicine at the University of Chicago. She's the Associate Director of the Center for Endoscopic Research and Therapeutics and the Director of Endoscopic Ultrasound and Advanced Endoscopy Training. We also have Dr. Sonia Kupfer. Dr. Kupfer is an Associate Professor of Medicine at the University of Chicago. She's the co-director of the Comprehensive Cancer Risk and Prevention Clinic and the director of the Gastrointestinal Cancer Risk and Prevention Clinic. We also have Christine Drogan. Christine is a genetic counselor at the University of Chicago Medicine in the section of gastroenterology.
Welcome, ladies, and thank you so much for joining us today.
Thank you.
My first question today is for Dr. Siddiqui. Can you just please tell us what is the pancreas, what does it do, and why is it a vital bodily organ?
I think that's a great question. The pancreas serves a number of bodily functions, but probably the two most important things that it does, number one, it aids with digestion. So it produces pancreatic juices that have enzymes that help you break down food, specifically fats. And then it also produces hormones. And probably their most important function is to help regulate glucose or sugar control.
Thank you. Dr. Kupfer, can you give us a little bit of background about pancreatic cancer? Where does it start, or how does it start, and are there any symptoms that our viewers should be looking out for?
Yeah, so the vast majority of pancreatic cancer develops from the pancreatic duct. So this is a channel that runs through the organ, and that's where those pancreatic juices flow through on their way to the small intestine. And the vast majority of cancers will develop from that duct. The issue with pancreatic cancer is that unfortunately early on there really aren't that many symptoms, or the symptoms can be very subtle. So things that we would be looking for is new abdominal pain, new back pain, a change in the color of stool and urine. Sometimes if there's a blockage of bile, people can turn yellow or jaundiced. And then in some cases, if people are developing diabetes, despite not having any of the typical risk factors for diabetes, for example, if they're losing weight, that could also be an early warning sign and would warrant them to see their doctor.
And what are some other risk factors for pancreatic cancer, and what can people do to reduce their risk?
Yeah, thanks. Another great question. So there are risk factors that people can do something about and other risk factors that they can't do anything about. So in terms of the ones that we know are modifiable or that you can change, obesity is one of the risk factors. So we want to make sure people's body mass index or their weight for their height is in the normal range. Smoking is associated with increased risk of pancreatic cancer. As I mentioned, if someone's developing new diabetes, this can be an early warning sign. Individuals who have chronic pancreatitis, those especially who have a genetic predisposition to chronic pancreatitis, are at risk. And then things that are not modifiable, so men seem to have a slightly higher risk than women. African Americans have higher risk. And then family history and genetics play a role as well.
So speaking of family risk and genetics, Christine, you're a genetic counselor. Can you talk a little bit about the genetics behind pancreatic cancer and talk about genetic testing?
Absolutely. So about 10% of pancreatic cancers are caused by a genetic mutation. And when we are talking about doing genetic testing, what we do is look at a sample of your blood or your saliva and do a genetic test to see if we can identify a mutation that would result in an increased risk of pancreatic cancer and possibly some other cancer types as well.
And who should get genetic testing for pancreatic cancer?
So people with a family history of pancreatic cancer should consider genetic testing, especially if that's in a close relative. So someone like a brother or sister, a parent, or an aunt or uncle or grandparent. And also everyone who has a diagnosis of pancreatic cancer is recommended to have genetic testing too.
And how or where can someone get genetic testing for pancreatic cancer?
So at the University of Chicago, I see patients alongside Dr. Kupfer who have family histories of pancreatic cancer, and we do genetic testing for them. So that's something that can be done here at UFC.
Great. So Christine mentioned genetic testing for pancreatic cancer, but is there, Dr. Kupfer, is there a screening for pancreatic cancer, whether or not you have a genetic risk?
Yeah, so of course, our goal would be to detect pancreatic cancer early enough so that individuals could get surgery to remove the tumor and wouldn't need to have chemotherapy, etc. Or really, if we could catch it in an precancerous stage and do something about it at that point, that would be ideal. Unfortunately, pancreatic cancer screening is not at the stage that other cancer screening is. So colorectal cancer, breast cancer, prostate cancer all have relatively easy ways in which to screen, and pancreatic cancer is not there. However, we are very hopeful that through some of the things that we are studying at the University of Chicago, that we will be in a position to be able to detect pancreatic cancer early, or even to find it in its precancerous stages. So the way in which that is done right now is to alternate between two different kinds of imaging tests of the pancreas. So just to take one step back, the pancreas lies very deep within the abdomen, and so it can be hard to get there to even look at the organ. So the two screening tests right now are first an MRI test that specifically looks at the pancreatic duct where many of the cancers will develop. And that test is often alternated with an endoscopic ultrasound that is a scope that has a little ultrasound probe at the end and goes into the stomach to also look at the pancreatic duct. In addition to that, we also will recommend individuals get a blood test called the hemoglobin A1C, which is a measure or a screening test actually used for diabetes, because having diabetes, new onset diabetes, can be an early warning sign for pancreatic cancer. So right now our screening is done for individuals who we consider at higher risk. So those are individuals who have multiple family members with pancreatic cancer, so we call that familial pancreatic cancer, or individuals who have a genetic mutation that is associated with pancreatic cancer. And in most cases, we also require that those individuals have a family history, because what we're still trying to determine is who is actually at the highest risk, who would benefit the most from this kind of alternating screening.
Thank you so much for that detailed explanation. Dr. Siddiqui, how does the University of Chicago approach the treatment of pancreatic cancer?
Going back a little bit to what Dr. Kupfer mentioned, we are one of the few centers that do offer endoscopic ultrasound first for screening, and it is an endoscopic procedure. The three of us at the University of Chicago that perform this procedure all did an additional year of training just to become experts at it. So we're very good at picking up small lesions, whether they're a benign cyst or cancer that, we're hoping that we're going to pick up at a smaller size and stage. So we do participate in the screening aspect, but then also oftentimes a patient presents to an outside physician with whatever symptoms that prompted a CAT scan or an MRI, they're found to have a mass in the pancreas, and then they're sent to us for an endoscopic ultrasound, which in 2020 is the gold standard for getting tissue and making a diagnosis of pancreatic cancer. And the reason is that with our ultrasound scope in the stomach, we have a very close-up view of the pancreas, and particularly what we call the body and tail of the pancreas, which are the kind of the second and third portions of it. And then a little bit farther down in the small intestine, we get a very good view of the area called the head of the pancreas, and we're able to take samples. And we also have expert cytopathologists who come in the room with us when we're doing this procedure, and they are looking at the slides that we make from the cells that we obtain from the tumor, and they are trying to give us a diagnosis at the time of the procedure. So we try to diagnose the patient that day, and by the time the patient wakes up in recovery, we've already made arrangements for referrals to surgical oncology and to oncology, because again, your best hope for a good outcome in this disease is trying to detect it early, but trying to get ahead in terms of management and getting going on treatment.
And you know, we're in 2020 right now, in the middle of a global pandemic. Is there any has COVID-19 affected pancreatic cancer screening, or does it have any discernible effects on pancreatic cancer patients? Is there any pertinent information that we should know regarding COVID-19 and pancreatic cancer?
Well, obviously, you know, the pandemic's affected everyone in and out of the medical world, but I will say we're very fortunate at the University of Chicago to have put into place a lot of protocols to try to keep the medical staff and our patients safe. So patients who have a potential pancreatic cancer that needed an endoscopic ultrasound for diagnosis and further treatments after that were prioritized, and we were able to continue seeing those patients without any delay at all. And then we're open at full capacity as much as the patients want, but some patients, if it's just a screening test, I will say, you know, some of them have opted to just wait a little bit longer to get the procedures done. And it's hard to say how much that will affect long-term in terms of diagnosing or missing a cancer, but we really haven't had to slow down because of the pandemic, fortunately.
That's great to know. Christine, could you talk or just mention some organizations that you know of that are doing good work around pancreatic cancer in terms of getting resources out to the community?
Yeah, absolutely. And one that we're very happy to partner with is the PROCEED Consortium. This is a group of multiple hospitals around the United States and around the world whose main goal it is to come up with better ways for early detection of pancreatic cancer. And so this is a great resource for people who are worried about their family history or want to learn more about the genetic risks of pancreatic cancer. And so we're very happy to be a part of that consortium. There are a few others like the Royal Foundation and pancan.org that are also great resources for people who are interested in learning more.
Great, thank you. Dr. Kupfer, this next question is for you. Can you talk more about the current research on pancreatic cancer and future directions?
Of course, this is an area that we are actively engaged in because we need to have much more information, and we need to do this as a research community. So that's why we are partnering with other hospitals in the United States and really worldwide to move this area forward. So we are part of a consortium called PROCEED, which will be looking at the outcomes of screening in high-risk individuals. And this will include not just their clinical outcomes, but also getting biospecimens so that we can hopefully find better, less invasive markers to do screening. So if we had a very good performing blood test that would tell us whether someone is at increased risk or has early signs of pancreatic cancer, that would be ideal. We have just completed a clinical trial with a company called Immunovia that is looking at immune-based markers in the blood that could aid us in determining who might need to have either earlier or more intensive screening among high-risk patients. And so the future is bright in this area. We definitely need patients to participate in these research studies, and we are so grateful to our patients who are participating, because this is really one of the ways in which we can absolutely impact survival in this otherwise deadly disease.
Great, thank you so much for that, and for reminding our viewers about the importance of clinical trials in advancing cancer research and cancer care. They are so important, and we do encourage everyone to check out uchicago.medicine.org to find our listing of available clinical trials. Thank you for that. So I have one last question for all of our panelists. What is the one takeaway that you hope our viewers will end this video with today? And I'll start with you, Dr. Kupfer.
So I think from my perspective, although symptoms can be elusive or mild or not very obvious, if there's any change in someone's gastrointestinal health, or a new and different back pain, or some kind of a change in the color of the stool or the urine, or they've developed diabetes, please see your doctor to be evaluated, just to make sure that you don't need any kind of testing for pancreatic cancer.
Dr. Siddiqui?
I would like to say that, whether you're someone who's at high risk for developing pancreatic cancer or you have pancreatic cancer, the University of Chicago is well suited to take care of you. We have everything covered in terms of expert care, from the genetic side of things to the screening side of things, diagnosing and managing the disease. I think our physicians get some of the best outcomes for their patients in the country, if not the world.
Wow. And Christine?
I think the most important thing, from my point of view, is just to make sure that you're aware of your family history. So sometimes talking about these things with family can bring up some old memories or, some uncomfortable emotions, but it's really important to have an idea of the cancers that are in your family and to make sure that you talk about those with your doctors so that they can refer you to the right people to get testing or screening.
Great. Thank you all so much for those key takeaways here. Thank you all so much to our viewers for joining us today on this Q&A video and for watching. For more information about pancreatic cancer, you can go to uchicago.medicine.org/cancer. That is the website to the University of Chicago Cancer Center. And you can also visit the website of PRECEDE Consortium, and that's www.precedeconsortium.org. And we want to again thank our panelists today, Dr. Kupfer, Dr. Siddiqui, and Christine, for sharing their wisdom and expertise. Thank you again. We hope you have a great rest of your day.
Thank you.